is the middle of World War II. An American Army hospital in Italy is completely overwhelmed. Bleeding, agonizing soldiers are being carried in by the dozens. The chief anesthesiologist, a man named Henry Beecher, is desperately trying to keep the wounded calm before surgery. But then his worst nightmare comes true. He runs completely out of morphine. The next soldier is brought in with severe injuries. The man is screaming in pure agony. Beecher knows that operating on him without painkillers might cause a fatal shock to his heart. In a moment of pure desperation, one of the nurses fills a syringe with plain salt water. She injects it into the soldier's arm and calmly tells him, "This is a powerful painkiller." What happened next completely shattered our understanding of human biology. Within seconds, the soldier stopped screaming. His heart rate dropped. His muscles relaxed. He looked at the doctors, completely calm, feeling no pain at all. Beecher successfully operated on him, and the man survived. But how? How did a syringe full of absolutely nothing turn off the excruciating pain of a war injury? Welcome to the most powerful, mysterious, and deeply misunderstood glitch in the human body, the placebo effect. For a long time, doctors thought the placebo effect was just a trick of the mind. They believed that patients who felt better after taking a sugar pill were just lying, or they were crazy, or they were just politely pretending to feel better to please the doctor. But today we have brain scans, and what we found is terrifyingly real. When you take a pill, even if it is literally made of sugar, if your brain truly believes that the pill contains a painkiller, your brain will physically manufacture its own painkillers. Your brain acts like a fully stocked, microscopic pharmacy. The moment you expect to be healed, your nervous system releases endogenous opioids, powerful chemical endorphins that are structurally identical to morphine. The pain doesn't just feel less intense. The pain signals are physically blocked from reaching your brain by the chemicals your own mind just synthesized. The healing is not imaginary. It is chemical. It is real. But if belief has the power to heal, it also has the power to destroy. If the placebo effect is the angel, then the nocebo effect is the grim reaper. In a famous medical trial for a new antidepressant, a 26-year-old man named Derek decided he wanted to end his life. He went into his bathroom, took his bottle of experimental pills, and swallowed all 29 of them at once. Minutes later, he collapsed. He was rushed to the emergency room. His blood pressure dropped to dangerously low levels. His heart rate was chaotic. He was sweating, shaking, and hyperventilating. He was actively dying from a massive overdose. The doctors frantically contacted the researchers who ran the clinical trial to find out what was in the pills. The researchers checked Derek's file, and they told the doctors a shocking truth. Derek wasn't in the active medication group. He was in the control group. The 29 pills he swallowed were pure sugar. There was absolutely no drug in his system. Yet, his body was systematically shutting down, mimicking the exact symptoms of a fatal overdose, simply because he was absolutely convinced he had poisoned himself. The moment the doctor walked into the room and told Derek the truth, that he had only eaten sugar, his blood pressure instantly stabilized. His heart rate returned to normal. Within 15 minutes, he was completely fine. His mind had almost killed his physical body, using nothing but the power of expectation. The placebo effect is so incredibly strong that the pharmaceutical industry spends billions of dollars trying to beat it. In clinical trials, new breakthrough drugs often fail simply because the sugar pill works just as well. And researchers have discovered something truly bizarre. The placebo effect isn't just about the pill itself. It is about the ritual. Your brain is constantly reading the environment for clues. Did you know that the color of a pill actually changes its medical effect? Red sugar pills act as better stimulants. Blue sugar pills act as better sleep aids. Yellow pills make the best antidepressants. And it gets weirder. 2 sugar pills work better than 1 sugar pill. A capsule works better than a tablet. A shot with a needle works much better than a capsule. And the most expensive sugar pill works the best. If a doctor gives you a fake pill and says it costs 10 cents, you might feel a little better. If they tell you it costs $5,000, and is a rare experimental treatment. Your brain will flood your body with a massive dose of healing chemicals. The white coat, the smell of the hospital, the expensive medical equipment. It is all a highly choreographed theatrical performance designed to convince your subconscious mind that healing is imminent. But surely, this only works for minor things like headaches or anxiety, right? You can't placebo a physical injury. In 2002, a surgeon named Dr. Bruce Moseley decided to test the absolute limits of human belief. He took patients suffering from severe osteoarthritis of the knee, people who were in so much pain they could barely walk. He split them into two groups. Group A got the standard, complex knee surgery to scrape out the damaged cartilage. Group B got a sham surgery. The doctor anesthetized them, cut open their knees with a scalpel, splashed some water around, and sewed them right back up. He did absolutely nothing to fix the joint. The result? 2 years later, the patients who received the fake surgery reported the exact same amount of pain relief and improved mobility as the people who got the real surgery. So the fake surgery patients even went back to playing sports. Their physically damaged knees were functioning perfectly fine, simply because their brain had registered the trauma of surgery and commanded the body to heal the area. For decades, doctors believed there was one golden rule. To make a placebo work, you have to lie to the patient. You must deceive them. But recent studies have completely shattered that rule. Doctors are now prescribing what is called open-label placebos. They look the patient straight in the eye, hand them a bottle of pills, and say, "These are sugar pills. They contain no medicine whatsoever. I'm giving you a fake pill." And the patients take them. And incredibly, they still heal. Their migraines disappear. Their back pain vanishes. Even when your conscious mind knows it is a trick, your subconscious mind cannot help but respond to the ancient, deeply ingrained ritual of taking medicine. You are walking around with an infinitely complex, million-dollar pharmacy locked inside your skull. It has the power to synthesize painkillers, lower blood pressure, and even alter your physical mobility. It is just sitting there, waiting for the right password to unlock it. The placebo effect isn't a fake treatment. It is the ultimate proof that the solid line between your mind and your body doesn't actually exist. If this mystery left you completely speechless, make sure to hit that like button and subscribe. Because next time, we are exploring a psychological glitch that is even darker. Until then, be careful what you convince your mind to believe.